Hello, everyone. Welcome to the 2024 Financial Outlook Briefing. I'm your host, Dan Murdoch, and boy, are we about to be very busy unpacking the major trends and challenges that will dictate financial success for healthcare systems in 2024 and beyond. I'm joined by my esteemed guest, Blake Madden, who will be weighing in on these topics and much more. In fact, we'll be disclosing recently completed research for the very first time that represents findings from over 110 finance, operations, and revenue executives across the country. Blake, welcome to the program.
Thank you. It's good to be on.
Amazing. All right, if you would, please give an introduction about you and everything you're doing at Hospitology.
Yeah, so just a little bit about me. Born and raised in Dallas, so thanks for coming out. And yeah, it's Dallas is a fun city. But so I did, right out of college, a lot of healthcare consulting and valuation and advisory type work. And then from there, just while I was doing that work, I started writing a newsletter on the side just because I was, interested in the space and wanted to learn more. And so that kind of just slowly snowballed into kind of what it is today, where Workweek reached out to me, and Workweek is kind of the umbrella media company I work under. And so I joined Workweek in kind of call it early 2022. And we rebranded my newsletter to Hospitology, and now I write about kind of like the business of healthcare and finance and strategy to, I think, is like 26 or 27K folks in the space. So it's been a wild ride, but it's a lot of fun, and it opens up kind of opportunities like this to have interesting conversations.
100%. And if you aren't subscribed to Hospitology, you should, because you are missing out. I mean, 27,000 subscribers, that's incredible.
It is. I like to compare it to like a football stadium, like 1/4 of UT's stadium. So we're getting there.
All right, well, we will fulfill that whole stadium at some stage in the very near future. Amazing. So, Blake, in the wake of one of the most challenging financial years in recent history for healthcare as a whole, it appears that we're turning the page a little bit as it relates to regaining our financial footing. What can we attribute to that? It appears that healthcare is in a position to achieve mission and margins once again.
Absolutely, yeah. So as you mentioned, over the past couple of years, post-COVID, a lot of providers have really been struggling with, the labor dynamics, the labor shortages, nurses quitting in droves. I think we'll be chatting about that a little later in our conversation. Inflationary aspects, and then just suppressed utilization. Patients and seniors are not coming in. We're not coming in to receive services, which, that's when you think about any business, price times quantity equals revenue, right? And so if you don't have the quantity and you're not getting the price, then that creates a disaster for your margins, especially when you have those expenses rising and squeezing margins on the, bottom part of that income statement, right? So moving into 2024, things are actually, finally alleviating a little bit for providers. There's hope on the horizon, if you will. Kaufman Hall released its kind of hospital flash report and noted kind of just a steady increase in operating margin for most hospital systems. And that's the result of a normalizing labor market and subsequent kind of post-acute length of stay, ability to discharge to home health or facilities or SNFs. So all of that's kind of alleviating pressure of like, getting folks in the hospital, receiving care, and then ultimately having them, discharged to the appropriate setting. So one, labor is alleviating. Two, inflation's alleviating a little bit. And then three, utilization is returning. So patients are kind of returning back to that normal cycle of, hey, let's go in and receive care and see my PCP and get vaccinations and those sorts of things.
So. Yep, and you've touched upon this, but the cost management landscape became under an extreme amount of focus as a result of those challenges last year, and we're beginning to see some of those dividends pay off this year. You've mentioned labor, some of the inflation components. What else seems to be the low-hanging fruit or the areas of most immediate opportunity that these healthcare providers are taking advantage of?
Yeah, that's a good question. I would say just doing the blocking and tackling right, So, like you mentioned, the labor and inflation are kind of just these big headwinds for organizations. So what are things that you can operationalize and like optimize from like an internal perspective? And so a lot of that is maybe looking at your vendors or like looking at your processes and figuring out what's, what is low hanging fruit for us to kind of figure out as far as like where can I like save on this expense bucket or the contribution margin for this department or those sorts of things.
Yep, certainly. Some of those things that we had seen is preventing unnecessary surgical supply waste, minimizing PPI, contract savings leakage, revisiting unfavorable contract terms, and of course, mitigating turnover, but in the context of the millennial sort of segment. I think all of this is really, really fascinating. You mentioned it. It's the balance of finding sustainable savings potential and then the time to realize that. And there's certainly so much more that could be deployed. One of the things that we're seeing, especially as it relates to labor, it's interesting because I think the focus has been mostly on clinical side of the equation. But in fact, through our research and our findings, talent acquisition and retention within RCM operations has been extremely challenging, almost mirroring that of the clinical dynamics. We found that nearly 40% of revenue cycle teams are struggling with this as a primary challenge. If you don't have people, of course, executing front, middle, or back end of the RCM process, you're not able to collect the revenue for the services you've already rendered. And so it's interesting how there is that parallel.
Yeah, exactly. And to your point, on the clinical side, there's been such an emphasis on retaining nurses and providing bonuses and like driving down those costs and contract labors to get nurses back into the clinical setting. Like nurses have been kind of the number one linchpin there. But on the other side, when talking to health system folks, they've mentioned like there's just as much of an onus on health IT, like your IT departments and RCM to find that talent who can, ultimately drive value for your business by, I don't know, like collecting money for the services you're rendered, right? So there's a huge need for that.
It feels like the more obvious area of low-hanging fruit to capitalize on, collect the revenue that you're expecting to collect. But as you know, and as we've experienced by speaking to hundreds of executives over the last year or so, this continues to be a challenge. To the point around the nursing component, it's just a staggering data point that we found that there's an estimated loss of nearly 200,000 nurses between 2020 and 2022. Being understaffed there is actually having a very clear negative impact on clinical outcomes. In fact, to the tune that there's nearly a 7% increased likelihood of a patient dying with each additional patient a nurse is assigned. That's staggering. And it's interesting because then the patient satisfaction data sort of reflects that as well. I'll rattle off a few here. 60% of US adults gave US healthcare a C or lower grade. 73% said that the US healthcare system was not meeting their needs. And 66% said providers seem more rushed than in the past. And they observed, 47% of those observed that those healthcare providers, those practitioners and those nurses and clinical staff seemed overburdened. And so, is there anything that you've observed or heard from executives about ways to mitigate any of that, or maybe things that are beginning to work?
Yeah, so the first thing I'll mention is just kind of like that's such a shame that nurses are leaving and there's just this constant kind of burnout theme in healthcare. I think that there's a lot of initiatives that folks like if you look at HCA or like other hospital systems are trying to do to retain nurses, and a lot of that has to do with culture, right? Nurses are your people. Nurses and doctors are some of the most trusted professionals within a healthcare setting. So like they're paramount to your operation. One, from a like actual rendering of medical services and getting patients healthier and out of the hospital, but two, like they help to set the culture clinically, and it's so important to just interact and communicate with them effectively. So things that these institutions are doing are providing nurses with career advancement opportunities, or like I mentioned, kind of signing bonuses. That's more of kind of like the upfront kind of recruitment tactic, right? But from there, how do you get a nurse to feel not burnt out, like feel valued at his or her organization, have opportunities for growth, and also like feel like you have the mental health kind of services or like wraparound support that you need to ultimately do your job well, but also like feel supported in that role.
Yeah, I think that emphasis on the employee experience as a whole, from the time they start, yes, you get that instant gratification around the bonus piece, but what's the sustainable strategy? And again, the parallel can be drawn to any part of that healthcare organization, but in particular, those that are at critical points of influence for performance, right? Whether it be on the clinical side or on the operations side, right? And that's where I draw that parallel to RCM teams and sort of applying that same methodology. I think it would go a long way. Yeah. To transition a little bit here, we're looking to isolate the formula of winning patients, scaling business operations, and deploying innovation to create a path for sustainable growth and achieving financial parity. In your opinion, what are some of those examples that executives are deploying today?
As far as like innovation is concerned?
Yeah, exactly.
Yeah, so especially at provider organizations, when I think about kind of that innovation component, the first thing that comes to mind is kind of like new methods, like alternative payment models, and maybe more specifically like value-based care, and more of a focus on quality and social determinants of health, and not just being focused on that specific visit in a silo in a fee-for-service system, but rather like in an ideal end state, there's this kind of quality value-based care component to where that patient is seen along his or her like entire journey, if you will. It's kind of like a buzzword, the whole person care, those sorts of things. But both inside and outside of that visit, where is that patient going? What do they need? What support do they need? And those sorts of things. So I think that that component of like kind of innovation and value-based care is really interesting. And then as far as just kind of more on the administrative side, how is, it's very sexy to talk about, but like how is AI being deployed? What are certain vendors doing differently to help kind of drive the needle forward for organizations, to help them do more with less, given like, the margin pressures we've described. So yeah, a lot of stuff happening in healthcare, as you can imagine.
Yeah, in a sense, it's almost very overwhelming, right? Like, where do you prioritize your efforts? And again, we've talked about where's the low-hanging fruit versus medium to longer-term dividends on making investments in the right areas. I think it's just so interesting, right? When you're trying to lower cost structures and make improvements from an overall efficiency perspective, I feel like there's no greater place than RCM, of course, biased, but it's the function of which you are decreasing costs and increasing revenue simultaneously. If you deploy the right technologies or the right people or the right processes or infrastructure to make that a much more harmonious process. I think the status quo has been to accept that, well, everyone finds this challenging, and so that doesn't make me unique. And I think the same mentality was applied maybe to the labor equation for many, many years, right? But if history is to serve as the right compass for us for improvement moving forward, because I'm certain that this will become an issue again at some stage in the foreseeable future, how do you mitigate this? It's interesting. I think those who adopt those strategies, those technologies, those areas of innovation will be the ones that stand apart from others. Are there any providers that sort of come to mind that you've spoken to or interacted with that are sort of embodying this?
Yeah, good question. I would say across kind of the value-based care landscape is an interesting space for that kind of like innovation in the sense that it kind of lends itself to, if you will, like the idea of integration to where like you want to know, you want to have the data, you want to have the analytics, you want to have the, rev cycle or whatever support functions to help see that patient across like longitudinal. So like, where did they get their x-ray done? Where did they get this surgery done? What's, this or that data point, those sorts of things across the journey so that they can then, put that picture together and say, okay, now we know what this patient is doing from a total cost of care perspective. What are ways we can like optimize or like send them to a different center of excellence or site of care, site of service, like where else can we send them that kind of drive value but maintain quality, those sorts of things.
Yep, totally. From our research that we conducted, we looked to understand where is that low-hanging fruit from a challenge perspective, and they range in the following order of significance: denial and underpayment management, responding to changes associated with payer adjudication rules and or insurer contract relationships, which we mentioned before, being in a position to renegotiate those effectively, having access to effective reporting, whether it be across the patient continuum or within the context of the various jobs to be done in phases of RCM, lack of system and data integration due to disparate nature of those tools and the sheer number of them, and then of course talent attraction and retention. This, in my opinion, is the sort of very definition of dysfunction, unfortunately. And I think the role that technology can play in assisting these leaders, it's never been more primed to do so, right? And so we talked about it a little bit earlier. You were saying like the mystique of adopting AI technology. There is hype and there is reality, certainly, to accommodate for. And so how do, in your opinion, leaders evaluate the right tools to work with, where to get started? How do they determine where to partner?
Yeah, no, great question. So I would say from an AI perspective, everything that I've seen, like there's a lot of folks that there's a certain camp that thinks AI can do a lot, like clinically, like replace a doctor or whatever, those sorts of things. And maybe someday that'll be reality. I think that we're pretty far on personally, but I could be wrong. But I think that really what you described as low-hanging fruit exists in the administrative side, right? And so partnering, in my opinion, with organizations that are kind of forward-looking and leaning into AI responsibly, like from a compliant perspective, to where like you are comfortable with what they're doing, but also from an RCM perspective, prior auth, automation or accounts receivable, kind of implementing AI there to figure out, who's more likely to pay or who should we nudge, those sorts of things. Or, just a wide variety of things AI can be applicable to in the administrative side of healthcare. And so when you're looking from a health system perspective, from somebody to partner with on the RCM side, what ultimately do you want to look for, right? You want to look for somebody who's not, like in 2024, not a point solution, more integrated end to end, has more flexible capabilities for maybe things like value-based care, population health initiatives, those sorts of things, but then also can do more with less and drive value for your organization. And so that's kind of the more nuts and bolts of the partnership. And then the other side of the partnership is if you choose to outsource or whatever your ultimate goal is with RCM, do you trust this vendor? Because there's at the core of healthcare is trust. You think about the core unit economic of healthcare, it's between a doctor and a patient, right? And so that's core to that is trust. And so extending from that is trust between a health system and an RCM vendor, as corny as that sounds. And so it's just so important though, because you've seen the headlines in the New York Times and other places to where things broke down and there was mismanagement of that operation, and things got out and your brand suffers from that perspective. And so it's just trust and just being able to communicate within that relationship is such an important component that can be overlooked.
It's such an amazing framework. We're going to make sure that gets documented and shared with the audience afterwards. I think the challenge has been not only all the things you just mentioned, but how do I contextualize this within my own organization, right? Deploying AI and ML or RPA within the context of RCM, where do I get started? Is it prior authorization? Is it eligibility? Is it claim scrubbing? What is it? And where do I get started? And what's going to have the highest impact? And I think to the point that you made around flexibility, but platform capable, that's certainly something we've taken as a philosophy from a technology perspective. But it's interesting. Our research showed that 23% of our respondents are currently leveraging AI-driven and/or automation technologies to improve RCM operations. So not the majority, but a significant percentage. And
more significant than you would think for healthcare.
Right.
And then secondarily, there's so much more white space to explore, even within that 20%, but also, the 80%, like there's just, I mean, when you think about, I think there's a report that comes out every year that 30% of healthcare spending is like waste or like administrative function. So like, how do we flip and optimize that 30% into like value, like for the patient, right? So that's actually a really interesting data point.
No doubt. And then looking under the layers of that, what are the areas that they're actually deploying this technology? Claim scrubbing and submission, prior authorization, as you mentioned, eligibility checks, coding verification, and charge entry. Now, of this series of respondents and the research that we did, 53% of those said that in 2024, there are initiatives to adopt AI-driven or automation technologies to improve RCM operations. So for that 80%, another 50% are actually looking to get started.
That makes a lot of sense. I mean, it doesn't surprise me. I think that it's very, one, sexy to talk about, right? And then two, like it's kind of the first product that has felt, apart from maybe like the Apple Vision Pro, right? That, people walking around, that feels like magic. Like when I first used ChatGPT, I was like, oh my gosh, it can do all this stuff. It can write code and all these sorts of things. So, like I mentioned, there's like a ton of white space. And I think that the buzz is getting out, and a lot of folks I've talked to are trying to figure out like, hey, what's next and what's applicable and what's practical.
Exactly. Now, of that 53%, they're looking to deploy it against eligibility checks, claim scrubbing and submission, coding verification, prior authorization, and cost estimates in that order, but all the same themes, which is really fascinating. There's just clear momentum to adopt these types of technologies to drive operational parity in RCM. And this is just the tip of the iceberg, right? And so we're obviously really eager to be a part of that journey for a whole host of providers across the country, and taking baby steps in the right direction that can help, again, transform an integral function of the business.
Yeah, and no, that's exactly right. And when you think about these, provider organizations or health systems, they're dealing with a lot of healthcare dollars. Like their revenues are pretty substantial. And so when you think about, AI, and even if it can get things 20% more efficient, like that's a significant potential like savings on your margin, right? And so that from Adonis's perspective too, that provides you guys with a competitive advantage, right? So you can deploy AI or like automation effectively, do things more efficiently, drive value for your enterprise customers, and also like, maybe you can, have more competitive advantages over potential peers, those sorts of things.
Yeah, I think because it's so correlated to soft and hard cost opportunity, it just feels like I think that's what's driving the momentum. It's like, okay, can I help save my team time and energy in, I've heard even as recently as last evening with a very large provider here in the Dallas area, they've got teams that are dedicating themselves to Google Sheets or Excel for 2 days out of the 5 days a week, just trying to comb through the data.
Google Sheets and Excel run healthcare,
right,
for sure,
yeah,
and most organizations.
Right, yeah, for sure. They're not alone in that fact, but it's just fascinating that nearly 50% of the week is spent just trying to reconcile manual data within traditional technology platforms.
It is crazy. And I mean, you think about something like, again, a ChatGPT type interface to where you're like, hey, write me code that does this in this Google Sheet or whatever, and then you deploy that. I mean, maybe you cut it down from 2 days to 1 day, and then like, okay, so what is that value? What does that drive value-wise within that organization? It's maybe you can cut your FTEs in half, or you can redistribute those FTEs to other support functions that help clinicians, or whatever it is. But again, like this, just when you talk about that theme of administrative complexity, I think that AI has an interesting responsibility.
That's the theme we heard last evening, which is like, oh my gosh, I can put my people in positions to impact higher orders of priorities.
It's almost like,
Please.
it's almost like you talk about like clinicians or like a physician practicing at the top of his or her license, right? It's almost like AI is enabling every single administrative employee or whoever is using it to also move that direction toward like the 20% most important tasks that they can like work on versus like all of the stuff that they normally need to do on the back end.
Precisely. And I think to the point of like those teams trying to isolate different reasons as to why something is not going right as it relates to an RCM related outcome, combing through the zeros and ones to determine why this particular service that was rendered, this particular code, this particular payer, trying to put the Rubik's Cube together, if you will, to finding the answer in that Google Sheet or Excel format is the clearest area of opportunity. We're focused on delivering an integrated experience where you can imagine your team sitting inside of a cockpit, if you will, that is giving them the alerts proactively to the challenges that are happening and the reasons why, and how is AR performing, and how are you mitigating denial management, all this stuff, right? And I think our data showed something really, really interesting as it relates to the analytics side of that equation, right? Do I have a pulse on A, what's happening, and B, what's going wrong, right? So then I can deliver and deploy my resources, my people, to going and solving those problems. Nearly 51% of RCM teams are presently leveraging a BI or analytics platform to report on RCM performance, which is certainly a step in the right direction, right? But it turns out that these platforms are oftentimes only just giving you the map, as opposed to using Google Maps or Waze or what have you. I use that analogy because it's good to know where something is, but how do you get there? What's the most efficient way to get from point A to point B? Am I identifying trends? Am I being alerted to the highest impact path to resolving that challenge? Avoiding tolls, avoiding traffic, all those types of things. It's interesting. So it's great that teams are being deployed those, and I know that a lot of organizations are investing a significant amount of capital into building these BI organizations, but it's a service layer organization more often than not, and they're not only just supporting an RCM team, but they're supporting all those other teams. And it's not quite meeting the needs and nuances of those organizations we're coming to find.
Right. It's funny. I love the map example because I was talking to someone the other day and we were just chatting about how, back in the day, you used to have to print off the Maps Go or like have a Maps Go in your glove compartment or whatever. And that's kind of like where healthcare is today, even still, right? In a sense. And it's right, like you mentioned, it's moving in that direction, moving in the right direction to where maybe we're on like V1 or like V1.5 of apps on the phone or that sorts of things. But where we ultimately want to get and where you guys are driving towards is that, the analytics and like becoming the Google Maps or the Waze of healthcare to where it's like, okay, there's an accident here. We need to be aware of that in real time, understand how to navigate that and move forward and, cut down my travel time by 10 minutes.
That's right.
Yeah, versus all of these other cars that are still on the highway, those sorts of things. So I do love that example.
Totally. Yeah, I mean, the whole point is just to enable strategic or tactical decision making that can drive the highest impact or highest consequent outcomes, right, for these teams. And unfortunately, just having a series of charts only tells the first dimension of the story, right? Anyway, to just transition a little bit here. Some providers are really looking to evaluate change in the way that they're delivering care. And you mentioned it before, value-based care is certainly one of those avenues. What is the state of that? I think from what we've learned, it's been challenging for providers to contextualize it, to operationalize it. Mm-hmm. What is it that you're observing?
Yeah, so definitely a lot of, like you mentioned, challenges from like a change management perspective, just because, when you look at a traditional health system or like traditional provider organization, what makes sense logically is, hey, I get paid for this patient. He or she comes in, I see them, I administer tests, I do this, do that, whatever, and then I get paid for those services, right? And so that still exists in value-based care, but on you layer on kind of, in a sense, more complexity, right? Because it's, how do you define quality? How do you define value? What are the support functions you need to like support like we mentioned, that longitudinal patient journey?
Yep.
So from like an actual core operational perspective, that's what's happening. From like a broader perspective, the Centers for Medicare and Medicaid want to move towards value-based care. Like they want to move every single provider into an accountable care type organization by 2030 because they think that that's a core way that they can save money on, there's a Medicare funding cliff, and we're all aware that the US is in trillions of dollars worth of deficits yearly and debt overall. So, how do we drive that down while also maintaining quality of like a program like Medicare? Okay, it's value-based care. That's the thesis, right? And so to that end, you've seen a lot of traction in value-based care within Medicare Advantage specifically, right? The privatized version of Medicare, but also in new programs like ACO REACH, which is a way to introduce accountable care organizations and value-based care into traditional Medicare beneficiaries as well. So all that to say, that's kind of like where the entire healthcare ecosystem is slowly moving. But there are challenges, like there's several challenges with Medicare Advantage health plans from the plan perspective this year. There's a lot of headwinds there, which like could trickle down to actual provider organizations trying to do value-based care, but also, you're seeing some impacts to multi-specialty groups, and they're having challenges as far as, just staying alive, because from a physician practice perspective, it's harder than ever to operate independently. So lots of different moving parts going on. I think overall you're moving in that kind of risk-bearing direction, but it's kind of, you need the underlying, like you mentioned, you need the ways, you need the analytics to support those types of programs to, lower total cost of care, but also maintain quality.
Incredible. As if there wasn't enough to deal with in the present.
We could talk another 2 hours about that.
There's no doubt about that. But Blake, thank you so much for the time. This has been a tremendous conversation. Yet again, you are a recurring host and guest, so we're excited for you to be doing more of these in the very near future. If any one of our audience wants to get in touch with you, what's the best way to do so?
Yeah, so I always just tell folks to Google hospitology. It's basically the word hospital and then OGY, all one word.
Okay, so very simple.
Very easy.
All right. But if anybody in our audience, of course, wants to get in touch with Blake or Adonis, feel free to email us at marketing@adonis.io or visit us at adonis.io. Thanks, everybody, for joining. And Blake, thank you again.
Yeah, thanks for having me, Dan. It was fun.
Awesome.